Good morning, all. I'm Dr. Santosh Ganapathy, Associate Consultant Surgical Gastroenterologist, Yashoda Hightech City. A warm welcome to you all. And today my topic is on important publications in early gastric cancer. A brief presentation outline. I'm going to cover important publications in definition of early gastric cancer, diagnostic and treatment advances, molecular biomarkers, and future directions. Coming to the definition of early gastric cancer, as we all know, early gastric cancer is defined as cancer confined to mucosa and submucosa regardless of lymph node status. This made possible by Murakami T, where he published in 1971 the morphological classifications of gastric cancers. And the key publications in endoscopic diagnosis were in 2009, AO et al. Published this optical diagnosis of EGC by magnifying endoscopy. And the other important topic I would like to cover is like artificial intelligence in early gastric cancer. In 2018, Hirasawa et al. Published AI in early gastric cancer detection. Almost 13,000 plus endoscopic images were fed to the system to identify early gastric cancers. This achieved almost 92% of sensitivity, detecting all cancerous lesion in test images. But surprisingly, the decisions were made in under 0.02 seconds. Thus, AI demonstrated a potential real-time second-time observer to reduce missed cancers. But there are limitations to the study, like only still images were used, it's a single center data, and benign images were missed. And the other important study in the diagnosis of EGC is like AI-based US diagnostic system for diagnosing the invasion depth of early gastric cancers. This study was from Japan, published in 2023. In this, almost like 8,000 endoscopic ultrasound images were used. This AI model demonstrated a diagnostic performance equal to that of professional experts. And coming to ESD, the key treatment modality in early gastric cancers, like revolutionized the treatment of early gastric cancers, offering curative resection without surgery. The key publications that changed the outcome were Gatoda, Ono, and Hirawa et al. And the key publications I find it's very interesting was the updated evaluation of ESD versus surgery for early gastric cancer. It is a systematic review published in 2020 in IJS. It suggests like endoscopic submucosal dissection is definitely less expensive, less traumatic, and provides a better quality of life. ESD is associated with higher risk of recurrences without compromising overall survival as well as disease specific survivals. But these patients need strict and careful surveillance. Thus, ESD provides an alternative to surgical resection in carefully selected patients. And the other important thing, which is very interesting thing, is like ESD showing positive margins. These are long-term outcomes of patients with ECG, who had lateral resection margin positives based on pathology following endoscopic submucosal dissection. It's a retrospective study. It analyzed almost like 3,500 patients who underwent endoscopic submucosal dissection in 2005 to 2018. In that, 123 patients were non-curative early gastric cancers, out of which 108 patients were followed up. In this 108 patients, it's a control group. They matched with patients who underwent curative resection after ESD. In this one, during the follow-up, a period of 8 years, they have underwent re-endoscopic resections as well as surgery, but the overall survival analysis demonstrated no significant difference. Therefore, observation may be a possible option for incomplete ESD if continuous follow-up is performed.